So a penile implant is recommended as a treatment option since you failed medicines, or you don't enjoy putting a needle into the side of your penis, or you want to have more spontaneous relations with your partner. So during the procedure, there's actually a prosthetic that's going to be implanted or placed inside the penis. There will be 2 rods or 2 basically balloons or cylinders that are going to be placed inside the penis. And then there's going to be a pump placed in the scrotum. And then there's going to be a balloon or a reservoir where the water is stored that's going to be inside your abdomen. And it's all going to be connected by tubing. And it's all through an incision this big or 2 incisions this big on the sides. A typical stay for the surgery is overnight, or you go home the same day. If you have any heart conditions, you'll need a cardiologist approval. It is a surgery. You will be having general anesthesia, so you will have to have someone drive you home if you were having a same-day surgery. Days before the procedure, you will have to do a special wash with Hebaclins soap. You'll need to stop your anticoagulants or your blood thinners. And if you're interested in having some penile lengthening, you may several weeks or months before use a vacuum erection device to try to get some length in your penis. You may need to stop your anticoagulants prior to the procedure, depending on what it is. Sometimes 7 days, sometimes 2 days, depending on the medication. Just like any surgery with general anesthesia, you'll have some dietary restrictions the night before, most likely. So for the surgery, you'll need to bring your activities of daily living, toothbrushes, contact solutions, toothpaste, and you may want to bring some loose-fitting clothing in a bathrobe. We don't want you to shave the night before the surgery. We will shave you in the operating theater or in the preoperative area. The morning of the procedure, you'll come having not eaten or drinking anything, and you will come to your procedure center. You will check in. They will bring you back into a preoperative area. You'll meet a nurse who will provide you a gown. You will also talk to an anesthesiologist. They'll ask you a bunch of questions about your medical history, including your allergies and medications and so forth. And you may get that quite a bit. There'll be a timeout prior to leaving to the operating room theater. You will meet the surgeon who will most likely get a consent from you at that time. And then you'll say goodbye to your loved ones, go back to the operating room theater, and then you will get your implant after anesthesia provides the anesthesia. And then you will wake up, leave it, go to a postoperative anesthesia care unit, and then be transferred to a floor or be discharged home with or without a catheter. To try to calm the nerves prior to a procedure, it's good to talk to as many people as you feel comfortable about the procedure. Ask as many questions about the procedure with your surgeon and myself. A lot of times we can give a medication to calm you down prior to the procedure. A lot of times anesthesia will give you a medicine to calm you down prior to the procedure. Sometimes if you want to talk to somebody that's had a procedure, the company or the vendor can provide a person that can actually talk about their personal experience with it. If you have questions before the surgery, I'd like you to call my office and talk to my nurse or talk to me.